Hi, I'm going to talk today about gynecomastia, also known as gyno or man boobs or moobs. It's all the same thing, and it's excess breast tissue in a male. And we often get inquiries with people asking, what is gynecomastia and have I got gynecomastia? Now, gynecomastia is not something that is a set criteria to decide whether you've got gynecomastia or not. There is not a diagnosis where you would say somebody's got gynecomastia and the other person hasn't. It is a subjective diagnosis, which means that if you feel that you've got too much breast tissue, then we can talk about whether you would like to have that treated. Whether we call it gynecomastia or not is academic. It might be a puffy nipple. Sometimes people have just a prominence behind the nipple. There's quite a wide spectrum of what would qualify to be gynecomastia. And the spectrum goes from significant skin excess and glandular tissue, so that you might look like a female breast, right down to just a little bit of puffiness and fullness behind the nipple. And at any level of that spectrum, you might want to seek treatment for it. Now, the treatment is based upon the degree of the gynecomastia, as to how much skin excess there is, how much breast tissue there is, and how much fatty tissue there is. And that is something that we can assess in the clinic. Now, what are the causes of gynecomastia? Why have I got gynecomastia? Now, there are several causes. One big cause is a hormone imbalance, and particularly at times like during puberty, and also what's called senile gynecomastia. So in older age, there can be an excess in breast tissue due to a natural hormone imbalance in your body. Therefore, if you are going through one of those stages, particularly puberty, then it is always best to wait until you've gone through that stage to see if if the hormones naturally come back into balance, and so the gynecomastia might improve on its own. So there is, if someone is during puberty has got excess breast tissue, it's always best to wait until they're through the puberty to see if that will get better on its own. Also, weight changes. If you're overweight, then it might be that by losing weight, the gynecomastia will get better. There are some rarer causes of your hormone imbalance, such as tumours, pituitary tumours, tumours around your kidney, and other sorts of tumours in the prostate and what have you, that can cause gynecomastia, either the tumour themselves or the treatment for those tumours. That's a much rarer group of patients. There can be some drugs which can cause it. Classically, steroids. If you're into bodybuilding in the gym and you're taking steroids, anabolic steroids, they can cause gynecomastia, and so it's important that if you are taking anabolic steroids, not to really undergo treatment for gynecomastia until you're able to stop those steroids, because if you continue to use steroids after the treatment for gynecomastia, it may well recur. It may well come back again. The other drugs is classically is the marijuana. If you smoke marijuana, this can cause gynecomastia, but there are other drugs that people can take for treatment of certain diseases which can cause it. But by far the biggest group of patients who have gynecomastia are what we call idiopathic in cause. Now, idiopathic is just a fancy name for there is no cause, or we don't know the cause. So the vast majority of patients, there is no underlying cause for the gynecomastia, and it's just the way it is. And I think we're all different with our bodies and our fat distribution and the distribution of tissues in our bodies, and some people have more tissue on their breast than others. So the vast majority of patients have no underlying cause, and so there's no real treatment for it as such. It's more addressing the physical problem. So if you have a physical problem, whether you call it gynecomastia or gyno or moobs or man boobs, it doesn't matter what you call it. If you have a physical problem, if you have an issue with your chest, if you feel that you have too much prominence, too much tissue on your chest, then it's something you can come and we can see if we can help you with it with surgery. Surgery is the mainstay of treatment, and it's something that we specialize here at the Gyno Clinic. If you'd like to come along for a consultation, please get in touch. And if you want any more details, there are guides on my website with some frequently asked questions, so you can always download a free guide. I hope that's been helpful. See you next time.